Next, please join me in welcoming our other co-presentation with Nicole Lowery from Humana and Darin Buxbaum from Wider Circle. Welcome both.
Thanks for having us.
Thank you. All right, so we'd love to introduce ourselves if you will entertain us for just a second. Hi, my name is Nicole Lowery. I am the Director of Population Health Strategy at Humana in our integrated health systems area, responsible for Humana's overarching strategy as it relates to health-related social needs and determining how best to implement those interventions, strategies, and methods, both internal and external. And really excited to be here with Darin today to talk about one of our partnerships.
Thanks, Nicole. I'm Darin Buxbaum, President and Chief Operating Officer of Wider Circle. So we're not quite as well known as Humana yet. What we do is we create neighborhood support groups and networks for vulnerable populations in Medicare and Medicaid.
All right, so we would love to talk to you today a little bit about integrating SDOH to close health equity and gaps and how to deliver business value. And I'll be the first to admit, I think we're both still trying to figure those pieces out, and we're learning as we're going. But what we do know is that in order to address these gaps, and we're going to call them gaps in care because that's exactly what they are, we have to invest in the whole person. And so I think everyone who is listening in today is probably aware of this, but I don't think we can say it enough, and I don't think we can enforce it enough, that 80% of what happens, or 80% of what impacts whether someone is healthy, occurs outside of the doctor's office. We often say the 5 most important numbers in a member's life is their zip code. And so that's really important, especially as you think about within a city. Zip codes that bump up to each other can have as great as a 30-year discrepancy in life expectancy. And so what causes those discrepancies? Social economic factors. You can see here 40% makes up what makes someone healthy. 10% is the physical environment, 30% of those healthy behaviors. Does the person who resides in that zip code, do they have access to be able to go to the gym or walk on the sidewalk without fear of violence? And so it's just really important that as we talk about addressing whole person health, that we really also look at what happens outside of the healthcare setting. So at Humana, we actually set a goal in 2015 to help improve the health of people in the communities we serve by making it easier for everyone to achieve their best health. And so we like to say, after 6 years, it's really part of our DNA. Right now, we have 19 communities that we have made a very strong commitment to impact the health as a whole. These communities we invest heavily in, and we are really excited to say that we had $6.2 million, 2 million SDOH screenings in 2020. However, we're actually over 13.4 million today. We have given back 816,000 more healthy days for our MA members in our Bold Gold communities in 2019. In 2020, with our partners in our retail product in our markets, we launched the innovative Healthy Food Card benefit. And we have launched strategic academic partnerships throughout 2020 to really, really focus on that physician of tomorrow. so that when a physician encounters a patient who has social health needs, they know how to have the conversation and how to screen and what to do. And then also we delivered over 1.4 million meals during COVID to our members who were in need. So it's really part of how we do business. And so talking about all of that, so we really focus on our data and analytics and our research and insights to screen our members and really test and learn into interventions that are going to make a difference in our members' lives. And that's one of the reasons Darin and I are here to talk to you today, is about a partnership that we're working on and trying to prove out, hopefully, that we can scale along the way. And so I'll just pop these up here for just a second. What it's really important, as you're going to see, why we focused on loneliness and social isolation and all the other impacts that being lonely and being socially isolated come about. So 29% of our Medicare members in 2020, in 2020, are lonely or severely lonely, and that means they're 64% more likely to develop clinical dementia. And then 29% increased risk of premature death. And so we also know that most of the time our members don't just have one social need, they have multiple. And I'm really excited for Darin to talk to us about the Wider Circle solution and why we partnered.
Many thanks, Nicole. Truly incredible work that you get to do every day to impact communities around the country. And we feel really fortunate to be able to start partnering in one of those communities. A quick introduction to Connect for Life, and that's our kind of flagship program. And it's really about creating a network of members, a trusted group in the community and in the lives of the Humana members, whereby we find that we can kind of broach all of the social determinants of health needs at once by having that support network. Now, this conference is very much about how do you tie SDOH to the business metrics and business outcomes. And we find that that's a critical part to this, and I'm going to talk a little bit to those metrics, but a lot of it is around how we can help boost revenue, engagement with care, and retention with plans as well. A quick snippet of how our program works. We are a very data-driven organization. We're headquartered here in Silicon Valley. It's kind of where high tech meets high touch with our program. We look at all of the claims and data and actually do algorithmic clustering. It's kind of like eHarmony, but for groups. And we use that to then do outreach to the members and invite them to actual, real events in person in their communities. Once members come, they tend to start in groups of about a dozen, and they get to know each other. Kind of most important parts are, one, they kind of make a connection in that group, and two, we find these super members who just can't help but want to help other people in their community. And that's a huge part of the behavior change that they help enable in our program. But after the first couple of months in the program, members graduate, and they graduate into a chapter community where they can continue to connect with one another and where more healthy behaviors are kind of introduced in that kind of peer-to-peer method. An important part of our healthcare system is starting to recognize now, and that this conference certainly does, is the criticality of health equity in our system. What I'm very proud of at Wider Circle is that 75% of our members that we serve actually come from communities of color. And I don't need to tell this audience just how much of an impact and disparity there can be in those communities. COVID unfortunately showed that first in a very stark manner of how severely many of these communities were impacted. And we've certainly done quite a bit of COVID work, including vaccination work in the past year. So how do you make that connection between, because you're probably talking to a number of interesting social determinants of health vendors, and connection between all the things that you need done as a plan, and the community work that's happening. And so we know plans have gaps that need to be closed, consumer assessment preferences that are getting measured more important, getting much higher weighting in stars and the like. And what we believe is it starts with a community, building a community of trust. We have our culturally competent employees, we call them facilitators, that are in each community that we serve. And then as members come on board, then we find the ambassadors. Those are your super members that really want to help inform and motivate others in the group to take better care of each other. Our belief here is, your members don't trust a vendor, but neighbors trust neighbors. And that's really what this community of trust is built on. And so once you have that trust, we find that those relationships automatically drive members to help each other with housing applications, with going to Social Security office and clearing things up, food insecurity, their transportation. A lot of that actually gets solved by the community itself. And also gaps are closed because people nudge each other. We will actually give a couple of examples of that throughout the presentation. But the end result is the metrics that everyone in a plan is measured on: quality, member retention, lower utilization, are the end result and we measure in the claims. And here's an example of something that I'd recommend for any SDOH organization that's working with plans, and probably how plans should measure them, which is measure it like any other program. We do a lot of matched control studies that look at the impact on utilization, on end of life costs, member attrition, and we love working with organizations. This is a national kind of risk-bearing provider that we did this analysis with. But at the end of the day, we need to show that how we're improving health equity and improving people's lives through actually fixing a lot of social determinants of health has impact on the bottom line to plans too. And that's a big reason why we partnered with Humana. We love individuals who have really sharp pencils. And Humana is a world-class organization. I'd say more so than almost any partner that we've had the opportunity to connect with so far. Really did thorough vetting ahead of time and put a very thoughtful plan in place for the measurements. And this may be an interesting model when thinking about vetting SDOH partners, but everything from having analytics group, like actually look at all of the underlying data, to visiting the actual programs, meeting and interviewing participants. It was a very thorough process for sure, but one that felt very good at the end of, because we knew that there was a great deal of alignment with the pilot.
Well, and Darin, I think it's really safe to say we had some trials and tribulations going through. COVID hit, right? COVID hit as soon as we visited and started putting pen to paper. And as you can imagine, we had to wait a little bit to get our members together in a location. These are our most at-risk members that needed this intervention more than anyone else. However, we had to be really thoughtful, and it took us a long time, right, to get this off the ground. We're still going, but it's been great to have a partner like Wider Circle help us figure it out. I think it was a first for both of us to have to deal with this.
Yes, COVID threw an unanticipated wrench in all of this, for certainly. But that's been an exciting obstacle to overcome, and most exciting because it's really helping people in their time of greatest need. And so we've certainly seen it had kind of quite a bit more impact because of that. Maybe to give just a quick scope of what a pilot looks like in a space like this, we typically pick an area. In this case, it was the Atlanta and surrounding counties. Pick a scope size, in this case, 1,000 participants. And then, of course, an endpoint, which, as Nicole had mentioned, and Humana's just done such great research on the true impact of loneliness and social isolation on healthcare and outcomes. And so this is very much our primary endpoint is around reducing loneliness to improve quality of life. And certainly we want to see the secondary impacts around engagement in health and overall utilization. So I'd be remiss, it's very hard to not talk about the members and the patients, because that's why we really do this. The primary endpoint is around loneliness. As Nicole mentioned, the pilot's still ongoing, so we can't release any data on it, but did want to share a couple of testimonials or snippets from members who are participating. For some, they recognize and are thankful that of how much the program has cured their severe loneliness. But the key around loneliness is really about not just bringing other people into older adults' lives. It's really about restoring purpose. It's in the blue zones, this would be like ikigai, the reason why everyone gets up and out of bed each morning. And that's a key part of why we have ambassadors and why it's really the community helping one another. And other members just can't believe how much, having other individuals in their lives have kind of reignited that source of joy, and how they have kind of this sense of hope again. So it's certainly part of the program that we enjoy. Of course, we talk about trusted neighbors and how do you close gaps, especially in communities that have been disenfranchised. And the majority of members enrolled in this pilot happen to be African American. And what we find, whether we're working in the Cambodian community, Vietnamese, monolingual, speakers in other groups, or in the African American community, we really see that connection where neighbors really do trust one another and want to help one another. And so Humana, for example, has a wonderful program called Go 365. And so one of the member ambassadors, in this case, Lewis, had an IT background, and he wanted to help the other neighbors. And so he made everybody bring their devices to a meeting, help them log in, to their accounts, figure out how all this works, how they can apply for the rewards, but most importantly, which preventative gaps that they still needed to close in order to, participate in the Go 365 program. And, it's different when you're in a group, you kind of have people nudging you and helping you. And we've seen it make a tremendous impact in people getting, the care that they really need.
I think it really helps to have someone who cares about you and can hold you accountable to make sure that you're going to engage in care.
Absolutely. And we see this across the board, whether it's folks helping each other sign up for silver sneakers or understanding dental benefits, which are always so confusing. It's just think about how all of us pick, a dentist or someone. We go to our friends, we ask them for advice, and members have the opportunity to do the same thing in their communities here. So kind of in closing, it's been amazing to be able to partner with Nicole and Humana. Certainly Bold Goal is a thought leader in how to approach SDOH and have impact at scale. And we've enjoyed setting up this hyper-local peer-to-peer networks to authentically engage the members, and in doing so, address gaps in health equity.
And for Humana, to echo everything that Darin has said, but it's also been really great to get our members together and have them give us feedback about the program, about building a community within a community. And one of the great things about Wider Circle's program is they do work really hard to get neighbors in their circles. So it's somebody's house they can walk to or can easily drive to. And so this can continue on moving forward as well. So we're really excited about the partnership and excited, Darin, I think, to see where this goes in the future.
Us as well. Thank you for the partnership, Nicole, and thanks to the Momentum folks for including us.
Very much.
Perfect. Thank you guys so much. And we actually got some feedback from someone who's Priscilla Obrazi says amazing work. So great job. And that's a great partnership. And thanks so much for being here. So I definitely look forward to, I know we're out of time, but looking forward to continuing the conversation a little bit later in our Meet the Speaker roundtables. And I want to thank you both. That was great.
Thank you.
Thank you.